My first client I chose, she's medication resistant, and her psychiatrist has been at her wit's end. She won't try any new medication. She's kind of like done with trying new meds. And so that was causing a lot of hopelessness for my patient. And she's tried TMS. We did EMDR with her. She's in a trauma group. She just felt that she could never get down to that deep trauma and process that and really be able to acknowledge it and let it go. And so that was our intentions. We worked a couple of weeks on setting those intentions and which traumas, were we going to prioritize and go through. And our results have been amazing. And she's actually hopeful for the first time. I've seen her since 2019. And her depression, she's diagnosed bipolar, mixed episodes, mostly depression. And she's on disability. She can't work. Like, there's a lot of things that were going against this patient. And after our first session, we were hopeful, and she was able to process some things deep down that she's never acknowledged even, and never even shared with another human being, and just sobbed during the whole session. And she felt it was very therapeutic. We weren't sure how it was going to do as far as with her depression. And, she's like 5 sessions in now, and she's doing great. And we're just completely amazed with how her transformation has been going. So that was actually just truly amazing to see her change so much since I've seen her for so many years, to see her now be hopeful, and she's attending AA, and she's getting out of the house and doing things. And I'm just like, whoa. So that is my experience with my most severe patient. And we have done 2 others. One patient is very tightly wound, and her diagnosis is anxiety. And so her main intention was just to be able to let go and relax. And so her repetitive thing she kept saying during her KAP session was, she feels like a noodle, and she felt really relaxed. And so we accomplished her goals. She was able to go home and take a nap, and she actually was able to just let things go for 45 minutes, which was amazing for that client. And so she was on the more of a functioning level than my previous client. And so to see the 2 spectrums and that they could help both was great.
This is a client that sought me out specifically to do KAP. And they had been suffering for a very long time with really deep depression and an eating disorder. Had tried many, many different types of therapy, talk therapies, working with coaches, and sought me out for KAP. And they've just made amazing progress. I really noticed with the ketamine assisted psychotherapy that it really attacks depression, and lifting out of depression can help clients tackle so many other things. And several people in this client's life that don't even know that they're doing KAP have noted back to them that they seem just lighter, more open. What I notice in counseling and therapy is we can go deeper. There's more space available to challenge the eating disorder and do real behavioral changes. And I've worked in eating disorder treatment centers before, and I know it's a very intractable illness. And so it's been really remarkable progress for this particular client after only about 6 KAP sessions.
The KAP work that I've been able to engage in has supported me with helping patients with religious trauma, racialized trauma, immigration trauma. Given the magnitude of these traumas, the overwhelm, the multi-generational effects that the patients I'm working with are sitting with, the ketamine helps to untangle the threads so that we can work more specifically with one thing at a time. Also supported us with not feeling so pressured to move beyond the pain so quickly, because there's less pain and less confusion. With less confusion, we're able to organize our work better and truly achieve the outcomes that my patients are looking for.